hot topics, we were talking about Steve Phillips from ESPN, who was heading to sex rehab after ESPN fired him over his affair with an employee. And we all wondered how an addiction to sex is treated and what does it mean. So here to tell us what happens in sex rehab is Dr. Gail Saltz. Welcome. You're a psychiatrist,
nice
doctor.
to be here.
Nice to have you.
Nice to be
okay, so what does it mean to be addicted to sex? It's more than just liking sex.
Correct. In fact, often sex addicts actually aren't even enjoying the act when they're doing it. But what it means is basically you are obsessed with sex. You're thinking about it and how to get it all the time. You have a compulsion. You're doing it, whatever the behavior might be. And it could vary. It could be having sex acts like affairs, but it could be looking at pornography. It could be masturbating. It could be exhibiting yourself. It could be all kinds of sexual behaviors. You build a tolerance, like in other addictions. So you need more and more of it to feed that. And the most important is that you end up doing risky behaviors.
This is both men and women?
Men and women, absolutely. Yeah. There's often a history of trauma in their past, sexual trauma in their past, or there may actually be another psychiatric diagnosis going on that's feeding this as well.
So what happens, you check yourself into sex rehab. Is that what it's called, sex rehab?
Yes,
yeah, okay.
sex rehab.
And what happens when how do they get you off it?
Well, as we're seeing, usually you have to, as you ladies pointed out, have to really hit rock bottom because most people don't want to admit to themselves that they have a problem. So something horrible happens, like your marriage is splitting up, you lose your job, you get a sexually transmitted disease, or something terrible happens. You acknowledge to yourself, I think I have a problem. Okay. The first order of business is education, acceptance. What is this problem, and what is healthy sexuality? Because for a lot of sex addicts, they don't know what it is to have a healthy sexuality. Then it's either some combination of individual treatment.
What do you mean by treatment? Talk
therapy. Well, the purpose of being in rehab is you can't do the behaviors anymore, right? So it's like an automatic detox, but not a physical detox like for alcohol or drugs, but psychologically, you have to stop. You're not doing it. And then at the same time, you're getting talk therapy to understand why this is happening, what in you is promoting this. You have couples therapy, or family, if it's involving the other people. You have group therapy, like a 12-step program. Just like for alcohol or drugs.
But how do we know that, because there's so many instances of, you hear about people cheating and men saying, or women, I'm going to sex rehab, that they're not just saying this to get out of hot water.
That's a very fair question because most people that commit infidelity are not sex addicts, but a lot of sex addicts do commit infidelity. So really what you're talking about is, do they have those risk-taking behaviors? Have they damaged themselves in some way? You have to look, do they really have all of these various symptoms to say that? So someone could use this as an excuse, but let's face it, it's not a very attractive excuse. No. And it certainly doesn't mean, because I want to make this clear, when you have this diagnosis, it doesn't excuse the behavior. It doesn't say it's okay. You're still responsible for...
Is this weeks that you go or months? Is it...
usually people will not stay in an inpatient setting for more than a month, maybe 2 months, but the bottom line is that may start you out on treatment, but we're talking about pretty much a lifelong process.
Do you have to check themselves in, or can someone put them in?
You really have to check yourself in, because to be committed, you have to be, not competent. A judge has exactly.
So when you're cured, does that mean you only want to have sex with your wife?
It means that
Why don't we come back? Let's come back and
it means
talk.
you want to have healthy sex. And what's difficult about sex...
Could I?
Yes.
Yeah, because we're getting time cues. When we come back, we will talk about how do you know you're cured, okay? We'll be right back. Okay, we're back with Dr. Gail Saltz because we were talking about sex addiction. Joy?
Yes, I was asking you, how do you know if you're cured?
Well, you really don't talk about cure, because in a way, you're never really cured. It's sort of like other addictions. You really have to constantly be working at maintaining healthy sexuality, but the thing that's more difficult about sex addiction is, unlike alcohol or drugs, where you're just going to not do it, you need to be having sex if you're in a relationship. Right. So it's a very tricky road. It's an endless road. Well, I mean, you always have to be working on it.
So if a man just wants to have sex all the time with his wife, even though she may not be into it, is that a sex addiction?
It may be, because if he's ruining the relationship because he can't go out and make a living because he's having sex all the time, she can't get out of the bed because they're having sex all the time.
Can't clean the house.
Then, Well, then yes, then that is a
What
sex
about
addiction.
medication? Because I know there are medications.
Absolutely. So sometimes we use medications that basically treat obsessive compulsive disorder because it kind of falls in that realm.
Right.
So some of the serotonin reuptake inhibitors and other kinds of antidepressants basically that are used for that. And sometimes we might treat because we might find that there's bipolar disorder, like manic or OCD, that is actually behind the problem.
What
have
if while you
addictions
are
of
there,
bipolar
what if while
disorder?
you're there and you're going to all these lectures and so forth, you're masturbating?
If you, constant masturbation is
All day,
absolutely,
Even when
absolutely
you're
a
in
problem.
rehab.
In fact, people can rub themselves raw and actually cause real injury to themselves, and actually it is sex addiction.
Are there warning signals?
Oh, absolutely. I mean, yes, if you are finding that your partner is, you know, if you're concerned your partner is repetitively cheating, if your partner's spending a lot of money or time with pornography, with hookers, it should be quite obvious. But if they're frankly in the bathroom, or they seem to be away and they are masturbating all the time, you know, this should be a sign to you. There is definitely something up.
Does it affect men and women differently, that sexual addiction?
It's a good question. Men are more likely to be struggling with this. Women who struggle with this, and they do, are more likely to have real sexual trauma in their past. And women, unfortunately, pay a higher price because they're more likely to get sexually transmitted diseases, and society sees men as kind of studly sometimes, and women as whores. So there is a double standard.
What do you say to people who, because this is not technically recognized in psychological textbooks right now as a official disorder?
Correct.
So what do you say to people who consider this as typically an excuse?
Right. I say to people that all diagnoses are a way for us to talk about a collection of symptoms. And, you know, there's not a blood test for anxiety either, or OCD for that matter. So there's not a blood test for this, but it explains a set of symptoms that are destroying your life. And if a set of symptoms are destroying your life and you can't stop on your own, then you need help.
And it's real.
And what difference does it make? But you're still responsible for your behavior. You're responsible for getting help. You know, you can't say, hey, honey, I've got a sex addiction, so you'll understand if I'm just going out and doing all
But
this
it
stuff.
is a stigma.
It
You
is
have to go
stigma.
into
You can't go around saying
Listen,
I'm a sex addict.
many mental health illnesses are a stigma. And that's very unfortunate in 2009. And we need to get past that so people can get the help they need.
Glenn Close was just here talking
Yes.
about that with her new
The
program
stigma.
to kind
So
of
which
lift
is
that stigma.
Which is the worst addiction to you? Drinking, gambling, sex addiction, drugs?
Alcohol.
Would I rather be run over by a car or stabbed or shot? You know, I mean, they're all quite,
Which one's the most destructive
Destructive?
to the family, let's say?
Wow.
you know, it really depends on the severity. They're all really, and you know, that's an important point. It's not just the person. It wreaks havoc across the family, friends,
And that should be
employment.
treated as something that is an illness and not something to make fun of. Thank you very much, Dr. Saltz, and we will be right back.